This topic isn't easy to discuss, and if it's not right for you at the moment, please feel free to click away now. The reason why I decided to do this video is because I will see these fluff pieces every now and again. Most recently it was this one, where people who know nothing about veterinary medicine are writing about trying to guilt and blame people about their choices they make surrounding pets' euthanasia appointments. Join me in this heartfelt discussion as we discuss the complex emotions and ethical considerations surrounding this topic. I did do some videos quite a while ago discussing quality of life assessment tools, and what the actual process of euthanasia entails. So I will not be covering that again in this video. I will link those other videos in the doobly-doo. The vast majority of the time, veterinarians do not put any pressure on pet guardians about whether or not they stay or go during a euthanasia appointment. We don't put that pressure on people. Media does, we don't. I've never yet personally met a veterinarian who pressures people one way or the other, because we've been through so many of these appointments. We understand the nuances that are going on. First of all, virtually no one comes in to a euthanasia appointment without having carefully considered surrounding circumstances and the complexity that this situation entails. Now, these individual situations are going to vary from person to person and pet to pet and situation to situation. And just in this part alone, there is so much nuance that's really impossible to try to summarize in a video. But we recognize that overall, people do not make this decision lightly. They agonize over it, they stress over it, they feel a lot of very complex things about it. And the last thing that we as veterinarians want to do is add more pressure and stress. It is very normal and common that people feel a lot of grief just around thinking about a euthanasia appointment. Some people also feel guilt surrounding the decisions, whether this is because part of the decision is being forced because of home life circumstances or financial circumstances, or that individual person's work schedule. There's just so many things that can play a role, and people put a lot of pressure on themselves when they're considering what is the best option for their pet. And as veterinarians, most of us are really good at counseling our clients about keeping the pet's welfare and quality of life the center of the discussion. And there have usually been a history of conversations that lead up to the euthanasia conversation. Now, occasionally there are emergency situations where things are decided a lot more quickly, and those are kind of a little bit of a different subset. Highly stressful situations where making these decisions needs to be done promptly. But in general practice, like I am, it's more common that people have some time, whether it's days, weeks, months, where they are contemplating and discussing making a euthanasia appointment. It's very crucial that people are using the quality of life assessment tools as they are going through this process, and I also recommend that people are working with a mental health professional as well. We know that the grief from losing a pet is equivalent to the grief of losing a human family member for so many people, and to have the support from a therapist or a counselor or some sort of mental health expert is invaluable as you are navigating this complex situation. People that are in the pro-stay camp will say that you need to do so in order to provide comfort to your pet. But as you learned when you went through the video on how euthanasia is done, the animal is sedated, and after that they are unconscious and unaware of what is happening next. They also don't have the comprehension of understanding what's about to happen to them. Usually when people are in these situations, they do stay through the sedation step, and that can be helpful, but for some pets that's even more stressful, and it really depends from situation to situation what's best for the individual pet. And as veterinarians, what our job is to support both the animal and the person in this situation as best as we are able to, and to make a plan that works for everybody involved and that optimizes the situation as best as we can. So the people that try to guilt others into staying are not fully understanding the process of euthanasia, and they also aren't comprehending the fact that what works best for one animal may be an absolutely awful thing for the next animal. The reality is that some people simply cannot cope with being present through the entire appointment. This could be because of a past experience they've had. This could be because of PTSD or other mental health diagnoses that can make this appointment very stressful and even traumatizing for that person to be present for. And as a veterinarian, I'm very aware of that, and I want to remove all pressure and expectation from the person. If they need to stay, absolutely, I will facilitate that. I will make it happen. If the person tells me, look, I just am not able to cope with being here this entire time, I fully understand and respect that as well. It is not easy. And for some people, having the last memory of their pet being sedated is better for them than having the last memory of that pet being dead. What one person needs for closure is going to be very different from what another person needs in their grieving process. In day-to-day practice, what I do find is that the vast majority will stay through the sedation step. And then after that, it's incredibly variable. Some people stay, some people go. Either choice is completely okay. What I want you to do is have open and honest communication with your veterinarian about what your individual needs are, discuss what to expect for the euthanasia plan, discuss what you think will be best for your pet, but recognize that in the moment we might have to make some changes depending on how the animal is responding. There is no one right way to approach a euthanasia appointment. There just isn't. Euthanasia appointments aren't easy on the veterinary staff either. We often have relationships with these animals. Oftentimes we've cared for them from when they first join their family, and we care for them all the way through up until their euthanasia. And what we want for each of them is to have a peaceful death that has as little stress as we can possibly make it. We care very much about our patients, about their experience, about the humans that they bring in with them. So I would encourage you to stop reading the fluff pieces that try to guilt people into staying all the way through a euthanasia appointment. Of course, prioritizing your animal's needs is going to be the main focus of the euthanasia appointment, especially from the veterinarian side of things. But we don't forget that there are people that are also very closely bonded with these animals, and we need to support them as well. These are not simple, easy situations. They are very hard, but having good communication with the team will set everybody up to be as successful as possible, and then having support for after the euthanasia appointment is also incredibly necessary, as the grieving process can be intense. The veterinary team is not best suited to help guide you through that process. You really do need a mental health professional, your family, your friends, your chosen family. So there's no judgment here, and there shouldn't be from your local veterinary team either. I hope that hearing this information helps to give you some peace and closure. Make sure that you take care of yourself as you go through the euthanasia process. If you have a future video topic that you want me to cover, make sure to comment that down below, and every week I do highlight a comment left. Here's this week's comment. Thank you so very much. I do put out a new video most Fridays. I hope to see you back next week, and make sure that you're taking care of yourselves. Alright, bye. Good girl. Yeah. You do a good job. Excellent. Okay, thank you. Good job. Good. All right, you can snip.